If you're taking GLP-1s for weight loss, like Wegovy or Zepbound, you know you're eating less. The big question is, are you eating enough to give your body the nutrition that it needs? I take GLP-1s and I've had weight loss surgery. And as someone who's had bariatric surgery, I've wondered if people who take GLP-1s should be taking the same kinds of vitamins that weight loss surgery patients take. There's a new advisory with some priorities for GLP-1 patients. It just came out in July 2025. And I'm going to break that down, and then I'm going to go through what I take for supplements as a weight loss surgery patient. My name is Sean. I've lost 140 pounds. I had a mini-gastric bypass in March 2022, and then shortly after that, I started taking GLP-1s. I'm a health journalist, and I help people who are thinking about bariatric surgery plan their next steps. So first, let's start with this joint advisory of 4 large health organizations, including the Obesity Medicine Association and the Obesity Society. They came out with nutrition priorities for people who take GLP-1s. Now, this isn't like macros, like how much protein or how many carbs or any of that. It's more looking at broad stroke priorities, but I think some interesting things are going to come out of this, so it'll be interesting to watch. Some of those priorities from this joint advisory are preventing GI side effects like nausea, which a lot of people experience when they start GLP-1s, accommodating dietary preferences. So for your food traditions and food culture, there should be a professional working with you, a dietitian, for example, to help you find healthy ways to eat that are sustainable for you because they incorporate your food traditions. Preventing nutrition deficiencies. Aha, they didn't say vitamins yet. We'll see. And then preserving muscle and bone. So you can see that this might be the beginnings of some type of supplementation recommendation, or at least encouraging care providers to start prescribing or recommending vitamins and supplements to their patients taking GLP-1s for weight loss. Let me break down what I take as a weight loss surgery patient so you can kind of get an idea. In my mind, there are so many similarities between the way that people who are taking GLP-1s and people who have had weight loss surgery eat that it makes sense to kind of look at bariatric surgery supplementation as a model for what GLP-1 patients should. Again, I'm not a medical professional, but having taken both and having worked in a field where I've been seeing and have friends who take GLP-1s, both of these really flip the table. When you're just trying to lose weight with a lifestyle, you're really kind of focused on calorie restriction. Once you start taking GLP-1s, or once you have weight loss surgery, or if you're doing both, which some people do, but once you go through those things, then to me it really flips the table because I don't have much of an appetite anymore. And, I'm certainly, limited in what I can eat because of the surgery that I had, as well as the impact of the medication. So it flips the table in terms of how I approach eating. Now I'm not so much focused on restricting myself or cutting calories. Because of the surgery I've had, I'm already restricted in cutting calories. What I focus now on is am I getting enough nutrition from day to day? That's my focus. Am I getting enough protein? Am I getting enough vitamins from the fruits and vegetables that I'm eating? Those are the things that are my priority now. So let me show you the supplements that I take. A lot of people think that bariatric surgery patients are taking supplements all day long. That's not true. You can streamline it. There are quite a few, but you can streamline it. And in my opinion, it's much better to take supplements, or I'd rather take supplements than have to take blood pressure medication or all kinds of other medications that can be expensive. Much rather take supplements. All right, so I'm going to start with a multivitamin. This is my surgeon has a proprietary line. There are a number of different bariatric vitamins out there. This is just my surgeon's proprietary line, which anybody can buy online. It's My Progress MD is the brand. And this is his Essential Nutrition Multi. It includes iron. So I take one of these every day. Then there is a vitamin B12 supplement, again, from my surgeon's proprietary line, my Progress MD. So I take one of these every day. I also take an iron supplement, and iron deficiency is an issue for people who have had weight loss surgery. This is an over-the-counter iron supplement that was recommended by the dietitian in my surgeon's practice. This is Garden of Life Vitamin Code Healthy Blood, and I take 2 of these a day. Then I take a calcium supplement. My surgeon does have a calcium supplement in his line, but the pills are really big and I don't like big pills. So I buy a liquid calcium supplement. I can buy this online, and I've also seen it in drugstores, but this is Nature's Way liquid calcium with vitamin D. And I do 1 dose a day. And then I also take a probiotic. My surgeon recommends a probiotic. He doesn't, give a brand name, but he recommends taking a probiotic every day. I use this. It's Regular Girl. It's a prebiotic and probiotic. It's unflavored. It's a powder, and you can put it into any drink, hot or cold. It's flavorless, colorless, odorless. It just changes the texture slightly, and it is FODMAP friendly. So if you need something that's FODMAP friendly, this is a good option. So this is a powder. This is a bag of powder. If you need something more convenient because you need something to take to work, or you travel a lot, or something to take to school, they also make little individual sleeves. It's a couple dollars more for a month's supply. And then most bariatric surgeons recommend a daily electrolyte drink. I've tried a bunch, and I don't like the ones that are salty, and I don't like weak flavor. Like, I want something really flavorful to kind of shake up all my hydration. So my favorite is Taste Salud. It's low sugar. It just has 1 gram of sugar, and it has really bold flavors. This is their mango chili lollipop, which is a limited edition that they do every now and then. They also have really cool flavors like cucumber lime, hibiscus. That's my favorite. They have orange, they have strawberry, they have watermelon, they have tamarind, they have mango, they have pineapple. They even have like a horchata flavor, which is really cool. So this is my favorite. You can get this online, and I've also seen it in Target. There's also other electrolytes. There are some that are just like liquid drops that are flavorless, odorless, colorless. They change the texture. They give a little bit of a slick texture. The one that my surgeon's dietitian recommended is called Daylight Drops, and you can buy those online or in drugstores as well. So I'm curious, if you are a weight loss surgery patient, how your vitamin routine, your supplement routine might be different. Please drop that in the comments, or if you have any favorite products that might help other people who are watching this video, please drop that comment below so people can see and learn, and we can share with each other. Also, if this video was helpful to you, please subscribe. I have other videos about weight loss, and if you subscribe, it would do me a favor, because I want to help other people who are thinking about weight loss, medical weight loss, whether it's surgery or medication. And when you subscribe, it lets the YouTube algorithm know to keep showing this video to people who may need it. So I would really appreciate that. Thank you for watching. I hope this was helpful, and be well. I wish you all the best on your healthcare journey.